is the model of the cerebellum. This is the correct anatomical position of the cerebellum. This is the anterior aspect of the cerebellum. This anterior aspect is a bit deeper than the posterior aspect. This is the posterior aspect of the cerebellum, and it is less deeper than the anterior aspect. This is all the superior surface of the cerebellum, and this superior surface is plane. We have divided the cerebellum into two cerebellar hemispheres. This one is the right cerebellar hemisphere, this whole structure, and this whole structure is the left cerebellar hemisphere. This central part of the cerebellum is the vermis, and now we are going to look at the inferior surface of the cerebellum. This is all of it is the inferior surface of the cerebellum, and this surface contains many elevations, and again this is the central part is the vermis. And now we are going to look at the superior aspect. The superior surface of the cerebellum has a very clear primary fissure. The primary fissure is basically a deep sulcus or deep groove on the superior aspect of the cerebellum, and it divides the cerebellum into anterior and posterior lobes. This whole structure is the anterior lobe, and posterior to the primary fissure is the posterior lobe. There is another horizontal lobe, which is a deep horizontal fissure, which is a deep fissure that is present within the structure of the cerebellum, and it is not visible on this model. Now there is a third fissure. This one is this fissure. This fissure is the uvulonodular fissure, because it separates the uvular part of the vermis from the nodular part of the vermis. So this is the uvula, and this is the nodule of the vermis, and this whole fissure, which is dividing the uvula and nodule, is the uvulonodular fissure. And the area that is present anterior to this is the anterior aspect, this is the posterior aspect. So the area that is anterior to the uvulonodular fissure is whole of this structure is the flocculonodular lobe, because these are the flocculus and this is the nodule. So whole of this lobe is named as the flocculonodular lobe, and these are the elevations. These are two elevations that are present on the cerebellar hemispheres. These two elevations are called as the tonsils, and this is the middle cerebellar peduncle. These two are the middle cerebellar peduncles, and they are present on the antero-inferior aspect of the cerebellum, and this middle cerebellar peduncles connect the cerebellum with the pons that is located anteriorly. As we place, this is the cerebellum, and this is the anterior aspect, and pons is placed here. So in this middle cerebellar peduncle connects this cerebellum with the pons. Cerebellum is located posteriorly and pons is located anteriorly, so middle cerebellar peduncle connects the pons and the cerebellum. This white region is the white matter, and this is the internal cross section of the cerebellum, and these are the white tree-like branches of the white matter, and these tree-like branches of the white matter are known as arbor vitae. This is a trunk of a tree. It is representing a trunk of the tree, and these are the small branches of the trees. So this whole structure of the white matter, tree-like appearance of the white matter, is known as arbor vitae. And now we're going to look at the blood supply of the cerebellar hemisphere cerebellum. On the superior aspect, one artery is supplying to each of the cerebellar hemispheres. This is the superior cerebellar artery, which supplies the superior surface of the cerebellum, and there are two inferior cerebellar arteries, as this is the anterior aspect and this is the posterior aspect. So this one is the anterior inferior cerebellar artery. These two are the anterior inferior cerebellar arteries, and these are the posterior inferior cerebellar arteries. Anterior inferior cerebellar artery is supplying the antero-inferior portion of the cerebellar hemispheres, and the posterior inferior cerebellar artery is supplying the posterior-inferior aspect of the cerebellar hemispheres. And this is all about the structure of cerebellum.